So a mammogram is an X-ray of the breast tissue. It's our best screening test for the breast. Now we use 3D mammograms, which are thin slices that we can look at throughout the breast, and it can screen for breast cancer. From the screening test, sometimes we have to do additional pictures called a diagnostic mammogram, where we take a more detailed look using different angles and different compression. Mammograms are typically done on a yearly basis for screening. However, if there are abnormalities, we might have to call you back to take some additional pictures. If there's an abnormality on there that requires some follow-up, typically we do a follow-up at 6-month intervals. So an ultrasound uses sound waves to give us information about the anatomy of the breast, and typically we use it to further characterize whether a mass or a lump is solid or cystic, and that can guide us as to whether we need to do a biopsy or not. So an MRI is a machine that uses a combination of magnetic fields and radio waves to create images of the body. It is our most detailed test of the tissues, and typically a breast MRI is ordered to further characterize a breast cancer, to give us a better idea of the extent of the breast cancer in that breast, but also sometimes it shows us additional things that we don't expect to find in that same breast or even in the other breast. So a biopsy is a procedure where we're trying to get a piece of tissue to further test an area of concern. We use a needle, and we use imaging to guide the placement of that needle to the area of concern. And this can be done in ultrasound, or it can be done in the mammogram room or under MRI. We get the tissue by using this precise localization, and then we send it to the lab to get further characterization of the tissue. We typically place a little marker in the spot as well that will show up in your follow-up imaging in case that spot needs to be removed, or for future reference, knowing that we had a benign biopsy in that area, we can see that marker.